Welcome to AmericanDraqon presents Chinese Medicine in America. My name is Joel Penner. I'm a doctor of Oriental Medicine, a California acupuncturist and herbalist, and a professor of Oriental Medicine. I'm also co-author of the textbook Zang Syndrome's Differential Diagnosis and Treatment. In this episode, I will be talking about the liver. It is very important at this point for me to remind you that even though they share the same names, the Chinese organs are vastly different from the Western organs. If you try to impose your Western understanding on the Chinese organs, you will get completely confused. Only in certain instances do they overlap. The Zangfu are energy or qi transformers in a complex bioenergetic system, and their functions relate to their qi transformation processes. There are 5 very important functions of the liver that I will be presenting in this episode. First, the liver stores blood. The liver is the most important organ for storing blood. It regulates the volume of blood in the whole body at any one time. It regulates blood volume according to physical activity. When the body is active, blood flows to the muscles, where it nourishes and moistens them to enable them to perform. When the body is at rest, blood flows back to the liver. While there, it contributes to restoring the body's energy. When blood flows to the appropriate places at the appropriate times, it nourishes the tissues and gives us energy. When liver function is impaired, there will be a lack of blood and therefore a lack of nourishment, which can lead to a lack of energy or qi, and the person will fatigue easily. The function of storing blood indirectly influences our resistance to external pathogenic factors, as the systemic qi deficiency results in a lack of wei qi, or defensive qi. If liver blood is hot, there will be heavy menstruation, called menorrhagia, or inappropriate uterine bleeding, called metrorrhagia. Most gynecological problems are the result of impairment of liver qi and or liver blood. If liver qi is stagnant, it can lead to stagnant blood, causing premenstrual tension, painful menstruation, called dysmenorrhea, and dark clots in the menstrual blood. The storage of liver blood also directly influences 2 extraordinary meridians that are not part of the 12 main channels. These meridians are called the conception vessel, the renmai, and the penetrating vessel, the chongmai. These are commonly referred to as the chong and ren, and their insufficiency is a frequent cause of menstrual problems. These 2 vessels are closely related to the uterus, and any imbalance of the liver will create an imbalance in these 2 channels. Liver blood also moistens the eyes and sinews. If it is deficient, there will be blurred vision, muscle cramps, and contraction of the tendons. There is a reciprocal influence between the liver and blood. If blood is deficient or hot, it may affect liver function, and conversely, if liver function is abnormal, it may affect the quality of the blood, causing certain skin conditions such as eczema or psoriasis. The second important function of the liver is that it ensures the smooth flow of qi. This is the most important of all liver functions and is central to almost all liver disharmonies. The liver ensures the smooth flow of qi throughout the whole body, in all organs and in all directions. Each organ's qi flows in its own normal direction, either downward like the lungs and stomach, or upward like the spleen. The normal direction of liver qi is upwards and outwards in all directions. Impairment of this function is one of the most common patterns seen in clinical practice, as it involves all parts of the body and can affect all of the organs. Ensuring the smooth flow of qi has an important and deep influence on the emotional state. If qi flows smoothly, the emotional life is happy. If qi circulation is obstructed, stagnant qi gives rise to frustration, depression, and repressed anger, with such physical symptoms as hypochondriac pain or a sense of an object stuck in the throat, even though nothing physical can be found. This is called globus hystericus. In women, it may give rise to premenstrual tension, depression, moodiness, and breast distension. Again, there is a mutual interaction. Any of the previous symptoms can block liver qi and lead to escalation of the emotional and physical imbalance. In a healthy person, the smooth flow of qi assists the digestive functions of the stomach and spleen. When the liver is blocked, it can attack or invade other organs. We can visualize this effect by thinking of someone putting a thumb over the end of a hose. The water sprays out uncontrollably in all directions. If liver qi stagnation invades the spleen, it can prevent the normal transformation and transportation of qi which flows upward. It can force qi downward, causing gas and diarrhea. The smooth flow of qi is all important in ensuring the harmonious movement in the middle jiao. The middle jiao is the crossing place of stomach qi, which moves downward, and spleen qi, which moves upward. Therefore, a harmonious emotional life is crucial to good digestion. The liver's function of ensuring the smooth flow of qi also affects the flow of bile. If liver qi is stagnant, the flow of bile may be obstructed, resulting in a bitter taste in the mouth, belching, cholecystitis, gallstones, or jaundice. Third, the liver controls the sinews. The state of the sinews, which includes tendons, ligaments, and fascia, affects our capacity for movement and physical activity. Contraction and relaxation of the sinews ensures the movement of the joints. It depends on the nourishment and moistening of liver blood. If liver blood is abundant, the sinews will be moist and nourished, ensuring the smooth movement of the joints and good muscle action. If liver blood is deficient, the sinews will lack nourishment and moisture. This may cause contractions and spasms, impaired extension and flexion, numbness of the limbs, muscle cramps, tremors, tetany, or a lack of strength in the limbs. Heat, such as a high fever from diseases like meningitis or encephalitis, can cause internal liver wind, with convulsions, tremors, and contractions. Fourth, the liver manifests in the nails. The nails are considered a byproduct of the sinews and are under the influence of liver blood. If liver blood is abundant, the nails will be moist and healthy. If liver blood is deficient, the nails will lack nourishment and be dry, cracked, dark, and indented. Fifth and last, the liver opens into the eyes. The eyes are the sense organ connected to the liver. If liver blood is abundant, the eyes will be normally moist and vision will be good. If liver blood is deficient, vision may be blurred, there may be myopia, color blindness, floaters, or the eyes may be dry and gritty. If there is heat in the liver, the eyes may be bloodshot and feel painful, burning, or itchy. If there is liver wind, the eyeball may turn upward and move involuntarily. As you can see, the liver's role in regulating the smooth flow of qi and blood is easily disrupted, especially by emotional problems, which can lead to a great number of pathological conditions. The Chinese believe that to get a true reading of a person's health, you must first clear the liver. Okay, that's going to do it for this episode. If you have questions, please contact me at joel@AmericanDraqon.com. In our next episode, we will address the functions of the fu or yang organs. See you then.